clavipectoral fascia splits to enclose the subclavius and the pectoralis minor and continues as what? It will continue as a suspensory ligament of axilla. Answer D. This is how it suspends. This is the pectoralis major. This is pectoralis major. This is pectoralis minor. Okay. And this one is subclavius below the clavicle. And this is the clavipectoral fascia between them, which is enclosing the subclavius as well as pectoralis minor, and then it is continuing. It will continue as the suspensory ligament of axilla. Suspensory ligament of axilla. Fine. Which are the following respiratory system components derived from the neural crest? And you see the laryngeal cartilage is direct answer, which is actually the derivative of neural crests. Laryngeal cartilages, they are developed from the neural crest. Fine. Wrong match about the bones and cartilages in the pharyngeal arches. So we have been given these choices and we have to find out which one is the odd one out. Okay. Meckel cartilage, mandible looks fine because both of them, they belong to the first arch. Richard cartilage, stapes, again fine, that is there is no problem. Second arch, again second arch cartilage with the styloid process, that is also fine. So obvious answer is D. Third arch does not make the lesser cornu, it makes the greater cornu. Okay. So that is the answer here, D. All are adult size at birth. Mastoid, antrum, ear, ossicles, tympanic cavity and the inner ear also. Those are the structures which are of the adult size. Okay. At the time of birth, this is the mnemonic. T is the tympanic cavity, I is the internal ear, M is the mastoid antrum, E is the ear ossicles. The maxillary antrum and the orbit is the answer here. Okay, they grow afterwards also. A 49-year-old woman has a large mass on the pelvic brim. Which of the following structure is most likely compressed by the mass when crossing the pelvic brim? Okay. So basically this question deals with the mass at the pelvic brim. Fine. Now among these given options, only one structure is there which is actually going to pass through the pelvic brim. So in case of a mass present at the pelvic brim, it can affect the structure which is passing through it. Okay, among these options we have only lumbosacral trunk which is going to pass from the pelvic brim and it will be affected by the mass. Okay.